Hi, I'm Dr. Dewanjee. Welcome to Knee Pain 101. This is our introductory lecture to knee pain. The first thing you need to know about knee pain is that knee pain can also come from problems with the hip and problems with the back. Knee pain that comes from the back tends to radiate all the way down to the foot and often to below the knee. Knee pain from the back is also often accompanied by numbness and tingling into the leg. The other source of knee pain is the hip joint. The hip joint, if it is arthritic or associated with a cartilage injury to the hip, can cause pain radiating into the thigh. Now here in this diagram, we have the three main bones in your knee. You have your femur, which is this bone here. You have your tibia here, and your patella. One of the other bones that is in the knee but not really a main part of it is your fibula, which is this bone here. There's four big ligaments in the knee, which is your MCL, your LCL, which prevent your knee from moving side to side, and the two big ligaments in the center are your ACL, which is this black ligament, and the PCL, which is in the hatched markings. The job of your ACL is to keep this bone from sliding forward, and the job of your PCL is to keep this bone from sliding backwards. Football players often tear this ligament here, your MCL and your ACL, and sometimes the cartilage here, when they get hit from this side, which causes this side to open up and then tear through this area and then tear through here. And then this bone ends up hitting this bone, causing a bone bruise and damage to the cartilage. The two C-shaped pieces of cartilage are a very common source of knee pain. So this is your medial meniscus, which means towards the middle of your body. This is your lateral meniscus, which means to the outside part of your body. When there's problems with the meniscus, say for example a tear like that, you get knee clicking, popping, or locking. The pain that, if it's torn on the lateral part, the lateral meniscus, you tend to have pain on the outside part of the knee and in the back of the knee. And if you have pain and problems on the inside of the knee, it's typically the medial meniscus that's torn and causing problems. Usually after an injury where somebody slips on a wet floor and sprains their knee, they typically most often sprain the MCL. The other sources of knee problems are the cartilage in the knee. As patients get older, they often have damage to the cartilage surface of the knee here. And the problems with this are various. Sometimes the arthritis can cause wear and tear of the entire surface of this cartilage on both the tibia and the femur, and then sometimes on the back of the kneecap, which is in the dashed markings. Once this happens, the treatment options are much different than if a younger person has a small hole, say for example like this, in the cartilage. The other sources of knee pain are problems with the kneecap. This is very common in women because of the shape of the women's bodies, where their knees tend to go out more and they're more knock-kneed, so the kneecap tends to ride outside instead of being centered on the knee joint itself. That concludes our Knee Pain 101. Look forward to visiting us for future lectures.